Hi, my name is Shelley Gardner, and today for my informative speech, I would like to talk to you about dementia. Did you know this year, 2015, that the Center of Disease Control and Prevention report that specific causes of dementia, typically the Alzheimer's disease, is estimated to affect 5.3 million Americans of all ages. Based on this fact, that means that every 67 seconds, someone in the United States will develop this disease. Alzheimer's is the sixth leading cause of death in the United States. 1 in 3 Americans, seniors, will die from this disease each year. It's the only disease that cannot be prevented or cured. My purpose today is to increase your awareness and tell you some of the treatment options that are available with dementia. Dementia is defined as an overall decline in cognitive function that may be caused by a variety of illnesses or injuries. It affects your memory, thinking, language, judgment, and very often behavior. Some dementias are treatable and some are even reversible. There are a few points that I would like to make today. The first point is dementia itself is not a specific disease. However, it is an overall term that is used to describe a wide range of symptoms. Dementia is caused by damage to or changes within the brain. It's a loss of mental skills that affect your daily living. It affects how you think and how you plan. It usually gets worse over time, and it affects everyone differently. Some people have a rapid progression of the disease process, and some are slower. The second point is there are several common causes of dementia that cannot be reversed, but it may be treated with medication to help slow the process. Alzheimer's disease, being the number one and the largest, is often referred to as senile dementia. This can be treated with to slow the process with medications. There are various different ones that I'll touch base on in a little bit. Vascular dementia is caused by strokes, tumors, head injuries, long-term high blood pressure. This also can be treated with medication to slow the process. And then you have a frontotemporal dementia, which is caused by Parkinson's disease. This can be treated to slow the process with medication therapy as well. Causes of dementia that may be treatable and reversed by using medications and or surgical procedures can be an underactive thyroid, which is called hypothyroidism. So if you take the proper medication to get your thyroid back functioning, it can actually reverse the memory loss. A vitamin B12 deficiency, medication or drug interactions, some brain tumors, and even depression can cause memory loss. All of those factors that I just told you can be treated, whether it's a surgical procedure or with medication to either reverse or significantly decrease the symptoms of memory loss. The fourth point that I would like to make is about the stages and the severity. There are several medications, as I said a while ago, that are available to help treat or decrease the symptoms of dementia. Some of those medications include Aricept, which can be used for all stages. You have Exelon, which can be used for mild dementia to moderate dementia. Remeron, Namenda, and Namzuric can be used for moderate and moderate to severe dementias. Mild dementia is a memory impacted for recent events like misplacing an object. The person may present with disorientation of time, however they know who they are and where they are. Sometimes they have communication blocks with conversations. Moderate dementia is these people can be highly distracted. They often switch topics frequently. They have difficulty following multiple steps, and their problem-solving skills are greatly impacted as well. And lastly, you have severe dementia. This person presents with severe impairment of their orientation to person, to place, to time, their environment, and even body parts. Their memory function is greatly impacted regarding short and long-term memory, as well as their semantics, which is their word-finding skills. They have difficulty responding to open-ended questions such as, what would you like to drink? They do better with yes-no type questions. Sadly, dementia is a fatal type disease, and there is no cure for this. The only way to actually diagnose somebody with Alzheimer's dementia, a factual diagnosis, is by autopsy. It is kind of a catch-all, and they are given that as a diagnosis, but in order to 100% diagnose it is by an autopsy. In conclusion, I would just like to let you know that dementia is a condition that results in an overall decline of cognitive functioning that may be caused by various different factors. Remember, we all forget things as we get older. However, memory loss that gets worse could mean that you or a loved one or someone you know may have an early onset of dementia. Watching a loved one slip away is scary and it's sad, so if you know somebody that's experiencing any of these symptoms, you might encourage them to go get checked out by a physician. Be sure to take care of yourself and beware of the warning signs. Here's a few facts I can tell you about dementia, if I can get it where you can see it up here. The three main symptoms, like I said, are cognitive function and mood changes. There are over 100 different types of dementia. Alzheimer's is the most common, and I apologize, my screen's not very big to share this with you on here. There are many challenges that people face. And I can tell you also that over 60% of Alzheimer's caregivers, whether it's of Alzheimer's or dementia, they are women. So for some reason, the women seem to be the higher persons in the caregiver category. Again, dementia is fatal and there is no cure. So we are hoping to continue research that we can help fight this, this condition, that we can try to find medications to treat it and improve and help people with their quality of life. I hope this information has been helpful for you and given you something that if you see these signs in somebody, you can help them get the treatment that they might need. Thank you.